Welcome back, viewers. So in today's session we will be discussing about the osteology of scapula. Okay, so this is the scapula, otherwise it is called as the shoulder blade, and it forms a part of the shoulder girdle. It is one of the bone of the shoulder girdle. Okay, and it is a flat bone which is triangular in shape. You see, it is triangular in shape and it is a flat bone which is triangular in shape. And then look, coming to its position, it is present in the posterolateral part of the chest wall. So it is present in the posterolateral part of the chest wall. So it is located like this in the posterior aspect. Okay, and it overlies the second to 7 ribs. It will overlie the second to 7 ribs. Okay, and then coming to its parts. So the presenting parts of scapula. Scapula has got two surfaces. So this is the costal surface which is concave, directed anteriorly, and this is the dorsal surface which is directed posteriorly. Okay, so it has got two surfaces, that is the costal surface and the dorsal surface. Now it has got three borders. What are those borders? So it has got a lateral border. This is the lateral border. It has got a medial border. This is the medial border, and it has got a superior border. So it has got two surfaces and three borders. Three borders are superior border, medial border, and the lateral border. And it has got three angles. What are those three angles? So it has got a superior angle, it has got a inferior angle, and it has got a lateral angle. So lateral angle is present at the place where the superior border will meet the lateral border. So this is what we are calling as the lateral angle of the scapula. So if you see carefully, this angle is truncated, and it forms a cavity which is called as glenoidal cavity. This glenoidal cavity, it will articulate with the head of the humerus to form the shoulder joint, a ball and socket type of joint. Okay, so this glenoidal cavity which is pear shaped, see this glenoidal cavity, it will represent the head of the scapula, and the remaining is the body of the scapula. This glenoidal cavity is representing the head of the scapula, and the remaining parts are representing the body of the scapula. So the immediate constriction which is present just behind the glenoidal cavity, you see this constricted part, it is called as the surgical neck of scapula. Okay, so how do we demarcate this? So this is the suprascapular notch, and you have one tubercle here which we are calling as infraglenoid tubercle. So if you draw one line from the suprascapular notch to the infraglenoid tubercle, so this is the suprascapular notch. From the suprascapular notch to the infraglenoid tubercle, if you draw a line, so that will represent the surgical neck of the scapula. Okay, so those are the angles. Next, coming to the processes, it has got three processes. So one, this is the spine of the scapula. Then this is the acromion process of scapula. And then you can see one bent finger like process like this. This is the coracoid process of scapula. So it has got three processes. One is the spinous process. So spinous process, acromion process, and coracoid process. So it has got three processes. So those are the presenting parts of scapula. Now moving on into the details. So what are the features present on each surface and border and all. So first we'll discuss about the costal surface. So I told you scapula has got two surfaces, that is a costal surface and a dorsal surface. So costal surface is directed anteriorly and it presents a shallow concavity. See, it presents a shallow concavity, and this if you see carefully in this costal surface, so this is the medial border. Along the medial border you can see a narrow strip of bone which is extending along the medial border, and then it is forming two raised triangular areas at the superior angle and at the level of inferior angle. So this is the narrow strip of bone which is running along the medial border, and then it is forming two raised triangular elevations at the upper end and the lower end. So this one and this one. So what is the importance of this? So this medial border, which is a medial border of the costal surface which is there, it will receive the insertions of serratus anterior muscle. This serratus anterior, it has got 8 digitations. Out of the 8 digitations, the first digitation will get inserted into the upper triangular area. So first digitation will get inserted into the upper triangular area, and second and third digitations will get inserted into this narrow strip of bone, and the remaining digitations will get inserted into this lower part of this medial border of the costal surface. Okay, so this upper triangular part will give insertion to the first digitation of serratus anterior, and then the second and third digitations are inserted into this narrow strip, and remaining 5 digitations they get inserted into the lower triangular area at the inferior angle. So that is about this insertion of serratus anterior along the medial border of the costal surface. Now if you have a look at the lateral part of the costal surface, it is having a rounded longitudinal ridge. So this is the rounded longitudinal ridge which is present at the lateral border of the costal surface. Now if you see the remaining part of the costal surface, it is being marked by 3 ridges. You can see bony ridges 1, 2 and 3. Those are running upwards and laterally. They are running upwards and laterally. So what is the function of these ridges? So from the total costal surface of scapula, the subscapularis muscle will take origin. So the serratus anterior digitation, they are getting inserted along the medial border of the costal surface, and the remaining part of the costal surface is giving origin to the subscapularis muscle. So the intramuscular tendons of this subscapularis muscle will get attached to these bony ridges. So that is why these bony ridges are present. Okay, so this intramuscular tendons which are there, they provide additional power for the anti-gravity action of the subscapularis muscle during abduction. So when you do abduction, it is an anti-gravity action. So in order to provide additional support, the intramuscular tendons, they get attached to these bony ridges. So that is the importance of the intramuscular tendons of subscapularis. Next, moving on. So with this we complete the costal surface. Now we will discuss the dorsal surface. So this is the dorsal surface of scapula. Dorsal surface of the scapula. So if you see the dorsal surface, it is divided by the spinous process into a small upper triangular part and a large lower triangular part. Okay, upper triangular part is called as supraspinous fossa because it is present above the spinous process, supraspinous fossa, and this lower triangular part is called as infraspinous fossa, infraspinous fossa and supraspinous fossa. Now you see the supraspinous fossa and the infraspinous fossa, they communicate with each other through a notch. This is the notch which is connecting the supraspinous with the infraspinous fossa, and this notch is called as the spinoglenoid notch. Spinoglenoid notch. Why? Because it is present between the spine and the glenoid fossa. So it is called as the spinoglenoid notch, which connects the supraspinous fossa with the infraspinous fossa. So now if you see carefully, the medial 2/3 of the supraspinous fossa along with the upper surface of the spine will give origin to supraspinatus muscle. Supraspinatus muscle. Okay. And then in the infraspinous fossa, if we see carefully, along the lateral border. So first, this is the infraspinous fossa which is present below the spine, and this is the lateral border. So you see along the lateral border, you can see a flattened strip of bone along the lateral border. So the upper 2/3 of the strip, this part of the strip will give origin to teres minor muscle. It will give origin to the teres minor muscle. And then the lower 1/3, this is the lower 1/3, okay, and it is separated by a oblique ridge. You can see this is the oblique ridge. This lower 1/3 part will give origin to the teres major muscle. Okay, so upper 2/3 of this flattened strip will give origin to teres minor, and the lower 2/3 will give origin to teres major. Next, the remaining part of the infraspinous fossa, which is there, it will give origin, and the undersurface of the spine, that will give origin to the infraspinatus muscle. Okay, so that is about the dorsal surface. We have seen this supraspinatus muscle, we have seen infraspinatus muscle, teres major and teres minor and teres major, and a small strip here near the inferior angle. So that will give origin to the few fibers of latissimus dorsi as well. You can see one small area over here. Okay, small area. So this will give origin to the few fibers of latissimus dorsi. Okay, so that is about the dorsal surface. So now we'll discuss about the borders. So lateral border first. So this is the lateral border of the scapula. So the lateral border otherwise is also called as the axillary border. It extends from the glenoid cavity to the inferior border. Okay, so extent is from the glenoid lower end of glenoid cavity to the inferior border. So this will form the lateral border, which is otherwise called as the axillary border. So this lateral border which is there, so near this infraglenoid tubercle which is there here, infraglenoid tubercle. So this is what we are calling as the infraglenoid tubercle. So this will give origin to the long head of triceps. So the infraglenoid tubercle which is there, it will give origin to the long head of triceps, and rest of the border, will give attachment to the subscapularis muscle along the costal surface, and we have discussed to the teres minor and major muscle along the dorsal surface. So the lateral border is monopolized only by origins. It has got only origins. Okay, so that is the speciality of the lateral border. Next, coming to the medial border. So this is the medial border. It extends from the superior angle to the inferior angle. So this is the medial border. It is otherwise called as the vertebral border because it is near to the vertebral column. We are calling it as the vertebral border. So here if you see the entire costal surface of the medial border, we have seen it is giving insertion to the digitations of the serratus anterior, and dorsal surface of this border, okay, so dorsal surface of this border, it is divisible into an area extending from the superior angle to the apex of the spine, and the area below the apex of the spine to the inferior angle. So along the dorsal border, from the superior border to the superior angle to the apex of the spine, it will give insertion to levator scapulae muscle, and across the apex of the spine, it will give insertion to rhomboides minor muscle, and below the apex up to the inferior angle, it will give insertion to the rhomboides major. So levator scapulae, rhomboides minor and rhomboides major. So this medial border which is there, it is monopolized only by insertions. Lateral border only origins, medial border only insertions. So next is the superior border. So this is the shortest of all the borders and it is very thin. So this will extend from the superior angle to the root of the coracoid process. This is the coracoid process, this is the root of the coracoid process from where it is begins. So superior border will extend from superior angle to the root of the coracoid process. So here near the coracoid process, it will present a small notch which is called as suprascapular notch. This suprascapular notch, by the attachment of one ligament like this, which we call it as transverse scapular ligament, by the attachment of that ligament, you see it gets attached like this. So the suprascapular notch is converted into a foramen, suprascapular foramen. So the suprascapular notch is getting converted into a suprascapular foramen, through which the suprascapular nerve will pass through. So through the foramen, suprascapular nerve will pass through, and above this ligament, the suprascapular artery will pass through. So through the foramen, nerve is passing, and above the foramen, the artery, that is the suprascapular vessels are passing. Okay, so that is about the superior border. Next, we will discuss about the lateral angles. We will discuss about the angles. So this is the lateral angle of the scapula. So it is truncated and now it is replaced by this glenoid fossa, and this is pear shaped. So this will articulate with the head of humerus to form the shoulder joint. So this glenoid cavity which is there, it has got a supraglenoid tubercle and a infraglenoid tubercle. Okay, supraglenoid tubercle which is there, supraglenoid tubercle, it will give origin to the intracapsular origin of long head of biceps. Infraglenoid tubercle will give origin to the long head of triceps. Okay, so that is about the supraglenoid tubercle and the infraglenoid tubercle. So now the floor of this glenoid cavity, this is the floor, it is covered with hyaline cartilage, articular hyaline cartilage, and this fossa, it is made deepened by the presence of a glenoidal labrum, that is nothing but a fibroid cartilage, in order to deepen the fossa which will articulate with the head of the humerus. Okay, so that is about the lateral angle. Next we will discuss about the inferior angle. So this is the inferior angle of the scapula. It is present at the junction where the medial and lateral borders meet. Okay, and this is present at the level of the 7th rib or the intercostal space. So this inferior angle which is there on the costal surface. So on the costal surface, it will receive the insertions of the lower digitations of serratus anterior, and on the dorsal surface, it gives origin to teres major and latissimus dorsi. We have discussed. So on the costal surface, insertion to serratus anterior, and on the dorsal surface origin to teres major and few slips of latissimus dorsal. So that is about the inferior angle. Next we will discuss about the superior angle. So this is the superior angle of the scapula. So superior angle is present at the junction where the medial border will meet the superior border. Okay. So this is the superior angle. So this superior angle, this is actually no muscles are being inserted over here, or they are taking, neither they are taking origin or insertion, but this superior angle, it is actually overlapped by a muscle, that is trapezius muscle. It is overlapped by the trapezius. It is overlapped by trapezius like this. Okay. So that is the importance of the superior angle. So now we will discuss about the processes. So we discussed that scapula is having three processes. One is the spinous process, acromion process and coracoid process. Okay. So first we will discuss about the spine of the scapula. This spine, it presents three parts. Okay. So it has got a apex, this is the apex, and it has got a base, this is the base. Okay, base, and it has got a posterior free border, and it has got two surfaces, superior surface and inferior surface. Okay, and this is called as the crest of the spine, Now this crest of the spine, it has got two lips. It has got a upper lip and it has got a lower lip. Upper lip, you see, it is continuous with the medial border of acromion process. Lower lip, if you trace it carefully, it is continuous with the lateral border of the acromion process. So it has got a upper lip and a lower lip. So here if we see the attachments on the spine, so this upper lip which is there, it is it actually receives the insertion of the fibers of trapezius, that is the middle fibers of trapezius muscle. It will receive the insertion of middle fibers of trapezius muscle. The posterior fibers of trapezius muscle will converge and they will get inserted in the lower lip, that is the deltoid tubercle here. Okay, but along the upper lip, it gives insertion to the middle fibers of trapezius muscle. Now coming to the lower lip, this is the lower lip. This lower lip will give origin to the posterior fibers of deltoid muscle. It will give origin to the posterior fibers of deltoid muscle. Okay, so that is about the spine of the scapula. Next comes the acromion process. So this is the acromion process of scapula. So it has got a, see, this is the acromion process of the scapula. So it actually projects forward as a flattened part of bone from the lateral end of the spine. It will project from the lateral end of the spinous process of scapula. And this acromion process, it presents two borders. So this is the medial border, this is the lateral border, and it has got a tip, and it has got a dorsal surface and it has got a under surface. So presenting process of acromion process are medial border, lateral border, tip, dorsal surface and under surface. So the lateral border, as we know, it is continuous with the lower lip of the crest of the spine. Medial border, as I told you, it is continuous with the upper lip of the crest of the spine. So the lateral border which is there, it will give origin to the middle fibers of deltoid. So acromial fibers of deltoid. You see, it is presenting tubercles. It will present 4 tubercles. You are able to see, it will present 4 tubercles. So that is for the origin of the acromion fibers of deltoid muscle. Okay, and then along the medial border, if you see, this is the medial border. You are able to see one oval articular facet over here. This oval articular facet, it will articulate with the acromial end of clavicle to form the acromioclavicular joint. It will form the acromioclavicular joint. So that is about the acromial process. And next, coming to the coracoid process. So a bent finger like process. So this one, it is bent like a finger. A bent finger like process which is present is called as the coracoid process. So it extends as a upward projection from the superior border of the scapula. It extends as a upward projection from the superior border of the scapula. So it has got a vertical part and it has got a horizontal part. So this is a vertical part and this is the horizontal part, and it has got a tip. Okay, vertical part, horizontal part, and a tip. So the place where the vertical and the horizontal part begin, the junction between the vertical and horizontal part, will present one tubercle which is called as the conoid tubercle. Conoid tubercle. And the borders here, they are generally called as anteromedial border and posterolateral border. So anteromedial border and posterolateral border. So this anteromedial border which is there, the upper surface of this anteromedial border, it will receive the insertion of pectoralis minor muscle, which is considered as the key muscle of the upper limb. Okay, so it will give insertion of the pectoralis minor muscle. Now this tip of the coracoid process, this is the tip of the coracoid process. It will give origin to coracobrachialis and short head of biceps. Common origin to the coracobrachialis and the short head of biceps. So these are all the origins and insertions, or otherwise the attachments of the scapula. So now with this we will see how do we determine the side of the scapula. Now that you know all the parts, we will see how to determine the side of the scapula. So you hold the scapula in such a way that this glenoid cavity should be facing laterally, and the concave costal surface should be facing anteriorly, and the spinous process should be kept posteriorly, and the inferior angle should be kept inferiorly. Okay, so glenoid cavity facing laterally, spinous process posteriorly, costal surface anteriorly, and the inferior angle inferiorly. So by that you determine the side of the scapula. So this scapula which is there in my hand, it will belong to the left side. It is a left-sided scapula. It is present like this in my body. So the glenoid cavity laterally, spine posteriorly, inferior angle inferiorly, and the costal surface anteriorly. So this is a left-sided scapula. So that is how we will determine the side of the scapula. Now coming to the ossification. The ossification of this scapula, it is ossified from 8 centers, of which 1 is primary and the remaining 7 are secondary. Okay, so the centers, the body of the scapula, the glenoid cavity represents the head and remaining part is the body of the scapula. So the body of the scapula, including lower 2/3 of the glenoidal cavity, it is ossified from a primary center, which develops at around 8th week of intrauterine life. Now the centers for the coracoid process will appear at first year of age, and the subcoracoid, including the upper 1/3 of the glenoidal cavity. So these will fuse, all these centers, they will fuse with the body by 15th year of age. Okay, so they will appear at first year and all these centers will fuse with the remaining part of the body by 15th year. Okay, so by the age of puberty, 2 centers will appear for this acromion process. 2 centers for the acromion process. one center for the medial border, one for the inferior angle, and one for the lower margin of the glenoidal cavity. Now all these which will appear after puberty, they will fuse with the body of the scapula by 20th year. So this scapula, it will complete its ossification by 20th year. Okay, so that is about the ossification of the scapula. So with this we come to an end of this session on osteology of scapula. So we will talk about humerus in the next session. So thank you for watching.